First of all, a few remarks about the economic impact of health and the health budget. Then a little bit about solutions for a sustainable universal health coverage. And last but not least, a little bit about managing universal health coverage in a multi-level governance framework. These are conditions you have in India, and I know that many state representatives are here, and also in many OECD member countries we have a very similar situation. But first of all, a few slides about the economic impact of the healthcare system in all of our countries. And what you can see on this slide, on the left part of the slide, you can see a change in employment in some OECD member countries in only 10 years. And what to learn about this is there is a high increase of people employed in the healthcare sector, in the social welfare sector in all OECD member countries, and in most all the other areas, employment is decreasing or is stable. That means the health sector is a job creation machine in most of our countries. But investing in health is not only useful for creating jobs. It is also very clear that investing in health means a better situation for workers in other areas, because workers with a good health status are more productive, are more present at the workplace. That means the labor force is stronger if the health system is working very well. And I know India is a young society at the moment, but in a midterm and long-term perspective, all societies in the world are aging societies. And then it will become more relevant if the health status is good or not good. And at the same time, it is very clear that the spending for health in most countries in the world is going up. You see here some GDP figures from some OECD countries. It was mentioned a few times before, but I think this slide is very relevant once again to illustrate it, that India spends, also compared to many other middle-income countries, like the other BRICS countries, a relative low share of GDP for health. And this is, I think, a fact we have to discuss also in the future in India when we talk about reform necessities in the healthcare sector. But also if you spend only a few money for healthcare, it is very clear in the future this share of GDP and this budget will increase, because in our societies there is a growing demand for health. This is not only based on aging societies. Most people believe, especially in OECD member countries, that aging societies are the main reason why expenses for health are growing. But that's not true. The two main reasons why expenses for health are growing in our societies is technological innovation and increasing income, especially in countries like India, where more and more people are entering the middle class. There is a growing need for health. There is a growing interest to spend more money for health. And that means in countries like India, where, and it was mentioned before, a lot of money to the healthcare sector is giving out of pocket. That means is giving by private money. There is a growing danger that this will bring back people into impoverishment. And that means we have to look at a growing need for health expenditures in all of our societies. Okay, a few remarks about solutions for a sustainable universal health coverage. And I will focus on three aspects, the tax base, then the question how to define the right package for universal health coverage, and a few remarks about securing value for money, because it is very clear you never have enough money for health care. Also a country like the US, where nearby 14% of the GDP are spent for health care, people would say it's not enough money for health. That means value for money is an aspect in every country in the world. Only a few remarks about the tax base and why it is so relevant. You know, in many countries we have a situation that there is a payroll tax for the healthcare system. This is maybe not a relevant solution for India because you have a very large informal sector when we look at the labor force. And that means this insurance scheme you have at the moment for companies with more than 10 employees working in a normal formal contract, and there is an insurance scheme, is not a realistic option for the whole society. That means looking at the tax base and broadening the tax base to finance these healthcare system for the future, I think, is the most relevant question in many countries in the world. And then you have to look at the aspect, what is financed? If there is only a small budget, and we all know there is a small budget in India, it is the very important question, what is our main interest? And what you can see here on this slide is that, first of all, we have to talk about access. If the budget is very small and not everyone in a society is covered, that means there is an uncovered population, I think the first step should be to cover all groups of the society in the healthcare system. And the second step is to think about, do we broaden the range of areas which are covered, or do we broaden or deepen, better to say deepen, or do we deepen the coverage for special treatment? And I would always recommend to be very selective in defining the range of services covered. That means to invest in the in-depth of covering and not in broadening to more areas and then to cover only a small part of these areas for everybody. And then it is, I think, very important to look at different gaps in these multi-level governance framework situation we have also in India. When you look at the OECD member countries, these are only a few of them, you have different ways. We have highly centralized systems, we have highly decentralized systems, and we have some mixtures of them. But in all these aspects, it is very clear we have often funding gaps, we have capacity gaps, and we have information and accountability gaps. Funding gaps, like I said before, you have never enough money for the healthcare system. Capacity gaps, something which is relevant for India too, when we talk about the labor force, when we talk about nurses, when we talk about well-trained doctors, it is very clear that there are still some capacity gaps. And last but not least, the information aspect, the accountability aspect. And this is the most relevant aspect if we want to control costs. People often think it is more relevant to talk about public or private delivery, to talk about national or regional service provision, but at the end, accountability and information system is so relevant to control cost, to monitor cost, to see what will happen in the future, and to decide what is needed on political action. That means this gap in information and accountability is a very relevant gap. Okay, let's have a look as a third point on some lessons from selected OECD countries, and I will focus on three short and brief aspects. Ensure that decentralized units spend enough on health and reduce funding variations. I think this is a very relevant example for India. Then to have a short look on balance responsibilities for health. And last but not least, to look at this aspect of accountability and monitoring. When we have a situation that there is a multi-level governance framework between the national level, giving a lot of funding, and we heard the figures between 30 and 35% at the moment, and we have the state level where often some services are delivered to the people in our countries, it is very clear it is important to incentivize state governments to expand health coverage to everybody in the society. You remember I said access to the healthcare system is the first topic, the first priority we should focus on in our societies. And that means we have to establish a system where this is incentivized by the national government when state governments are responsible. And we have to be interested in this mixture of responsibilities that there is a cost-effective intervention, and I will show you the example of Mexico in a minute. And of course, it is necessary to address inequities and variation across localities. That means to organize a fair and even distribution in the whole country. What Mexico did, and I think this is a very relevant example also for India, because Mexico is another middle-income country, another emerging economy with a high growth rate of GDP like India. What Mexico did was starting a new project called the Seguro Popular, and the first interest of the Mexican government was to organize that the access to the healthcare system is available for everybody in the country. And it is in Mexico, as it is in India, often a state government, a federal state or regional state responsibility. And that means Mexico defined at the beginning a small package of treatments which were covered by this Seguro Popular and incentivized the state governments that more and more people were enrolled in this Seguro Popular. That means the funding of the national government was linked to the rate of people enrolled in the Seguro Popular in the different federal states. That means if more people were enrolled, the funding was higher, and this was an incentive to the state-level government to organize and to inform people in their states how to enroll, what are the entitlements of these people. And I think this was a very first important step to increase the number of people which are participating in the program. And in 7 years, Mexico organized a situation that with Seguro Popular, at the beginning these were 90 treatments, now these are 280 treatments. That means a high share of the normal treatments available in the local primary care situation or in the regional hospitals is now organized by Seguro Popular, and that means a very successful program from our perspective. The second aspect, how do we balance responsibilities? And I think it is very important to notice that in most OECD member countries, there is a process that more and more responsibilities are re-centralized. And why does it happen? The reason for that is that when we look at quality and when we look at the level of the standard delivered to the patients, we could learn that some certain clinical procedures require high volumes for safety and efficiency, and that's the reason why we see a re-centralization, especially in the hospital sector. This is an example from Denmark. I know Denmark, the whole Denmark is smaller than most of the states in India, but also in Denmark we have a situation that now the responsibility for hospitals is going to a higher level to ensure quality and the standard setting in this area. And the last aspect, to conclude, is monitoring and accountability. I said before, this is the most relevant aspect, because if the monitoring is transparent, if the quality of performance is transparent, this is relevant for people to decide where to go, which hospital is the right one, which doctor is a good doctor. And this is also necessary for the state-level government and for the national government, to have better information, to have timely information about the results, about the cost involvement, what is going on in the healthcare sector. And that's the reason why this information infrastructure, this performance infrastructure is so relevant. And you can see here an example from Canada. I will not talk any longer about it, but Canada established a very detailed performance measurement in the different states. Also in Canada, we have this structure of state responsibility. and you can see that there are very different mixed results in the different states in Canada. This is a clear sign also for the national government to discuss with the state government what can we do to improve the situation. To sum up, a few remembering concluding thoughts. Spending more on health is a good investment for the economic impact, for the economic situation in all our countries, but it's very clear value for money is a relevant aspect. And when we have a situation like we have it in India, it is relevant to define a limited set of essential services as a first step which is covered, and then to broaden these kind of essential services in the future. And last aspect, if we work and cooperate in a situation with central, regional and local governments, it is very clear we have to develop a strong accountability framework to guarantee the quality and the performance of the system and also the cost effectiveness of the system. Thank you very much.